Harry S. Truman Library at Independence, Missouri, is the scene of an historic event. President and Mrs. Johnson and Vice President Humphrey arrive for ceremonies that will make the Medicare bill a part of Social Security coverage. The new bill expands the 30-year-old Social Security program to provide hospital care, nursing home care, home nursing service, and outpatient treatment for those over 65.
Well, the catalyst for Medicare was pretty simple, which is that you had elderly people who couldn't afford care, and they hovered between being bankrupted by getting care and waiting until they were too late in their disease to be effectively treatable. The challenge was that people wanted to be sure that we were paying for good health care, quality health care. So what started off was what were called professional standards review organizations. And they were devoted to assuring that care met the best professional standards. And they primarily did so by providing some education and by looking at specific episodes of care, especially ones that hadn't worked out well.
And then we really evolved to PROs, which were physician review organizations, and it really reflected reviewing cases kind of still on the individual care level. Another
milestone comes when serious amounts of data are collected systematically.
We look for patterns that come out and variations that are reflected in the data.
And what data basically said was, we're not doing as well as we could. We had a process in which we looked at charts, but we did what was called implicit review.
And we moved from sort of this random auditing of charts and following up on complaints to really doing targeted efforts around specific diseases and specific problems.
Improving the management of common chronic conditions such as diabetes or cardiovascular disease and heart failure, and build on those best practices to improve outcomes for our beneficiary population.
We recognized that also the problem wasn't often related to the targeted disease, it was more about the systems.
The bell curve shows you very simply, if you move the middle of the curve, if you move typical practice, you have a hugely greater impact than if you nibble away at the defective provider end of the curve. We were able to show that things had improved, but the fact that something was happening and you could measure it was a significant milestone in the growth of the program.
Then the name evolved to quality improvement organizations because that reflected the multidisciplinary approach of all team members, physicians, nurses, administrators, working together to improve the quality of care. The quality improvement organizations have been the boots on the ground in the communities, helping the patients, the families, and the providers carry out local activities and goals that really roll up into national progress.
A very important change occurred when the name of HCFA, Healthcare Financing Administration, was changed to the Centers for Medicare and Medicaid Services.
But it was not just about a name. It was about making the organization more responsive, more transparent. You've seen every year CMS open up, become more engaged with patients and with providers in a much more interactive way.
The QIO program has evolved in being able to establish stronger partnerships and being more collaborative, not only with their stakeholders in their actual regions that they actually serve, but also between each other.
Ideally, what you'd like to have, those that are performing high-quality work, working with those that may be having challenges and those that are not succeeding as they would like to, because then you can begin to share information of what worked and explore whether it would work in another setting.
Learning and action networks were developed in 2011 at the start of the 10th scope of work in an effort to bring together like-minded individuals around achievement of a common aim.
It is a mechanism and a collaborative force to bring all the stakeholders together who have a same common vision and focus.
Within the 10th statement of work, we really began to look to see what's going on throughout the Department of Health and Human Services, what were the priorities there.
The National Quality Strategy is the roadmap for how we are going to achieve excellence in healthcare. Yeah, I think the National Quality Strategy is the grounding force for healthcare transformation.
I see great transformation occurring every day in our healthcare system. I see that we are moving into a different era.
We used to be in a environment where it was very much, this is us and this is how we do things, and now you help us execute it. But now it's, we need your feedback, we need your input.
We've come a long way. It's a very different job from what it was to walk into a hospital 10 to 20 years ago and try to preach the gospel that you have to change systems in order to improve care.
I think it's a wonderful thing what the QIOs do. I mean, protecting a frail and vulnerable population and looking for ways to improve quality of care. I mean, that's phenomenal.